Welcome to Health Talks. Welcome to Health Talks. Today we're talking about diabetes and you. Diabetes is a disease in which the body's ability to produce and respond to the hormone insulin is impaired, resulting in an abnormal metabolism of carbohydrates and elevated levels of glucose in the blood and urine. There are two types of diabetes. Type 1, which is juvenile, and type 2, which usually involves older adults that weight has been an issue, metabolism has been an issue, and a lack of exercise. Type 1, juvenile diabetes. More than 200,000 U.S. cases per year of juvenile diabetes has occurred. Type 2, adult diabetes. More than 3 million U.S. cases per year affect adults. Let's look at the differences between the two types. Type 1, it typically appears in adolescence. Symptoms include increased thirst, frequent urination, hunger, fatigue, and blurred vision. If your child exhibits abnormal thirst and frequent urination and wetting the bed, you should probably have their doctor check for diabetes. Treatment aims at maintaining normal blood sugar levels through regular monitoring, which means testing your blood through a lancet and monitor, insulin therapy, diet, and exercise. Type 2 diabetes, which occurs in older adults, the body either doesn't produce enough insulin or it resists insulin. Symptoms include increased thirst, frequent urination, hunger, fatigue, blurred vision, and in some cases there may be no symptoms. In type 2 diabetes, a major clue is unexplained weight gain. Treatments include diet, exercise, medication, and insulin therapy. There are two types that are available according to what your symptoms are and where your blood sugar levels occur at and average. There are pills such as metformin that can be taken orally, or there are injectable insulin pens that are now available for type 2 diabetes. For both types, a glucose meter is used and insulin will be needed. As you can see in this picture, you see the lancets at the bottom, and you see the test strips, and you see the contour monitor, which will tell you what your blood sugar is at. This is where we talk about survive and thrive. Just because you've been diagnosed with diabetes doesn't mean you can't live and thrive. Diet is the first line of defense. The best diet plan involves large amounts of fruits, vegetables, high-fiber foods, and whole grains, wild and brown rice. Look for foods that are low in glycemic index. Multigrain breads, cereals, and pasta. Avoid most fats, especially dairy and animal protein fats, and salt. Weight loss is important. The greater the body mass index, or what we refer to as BMI, the closer a person is to developing diabetes. Overweight is a borderline diabetic. Obese is likely undiagnosed diabetes in some cases. Some natural ways, in combination with insulin therapy, the best medicines are natural and even becoming mainstream through medical practitioners and are beginning to see the benefits of these herbal cures. First, all we have proven is anti-inflammatory properties, and some, like cinnamon, actually help lower blood sugar. As with any medicine, whether natural or formulated, some work better for some diabetics and others they don't. A little experimentation is necessary. Seeing a diabetic specialist is recommended. They can help you track your insulin and track your blood sugar to figure out the right dosage of insulin and whether to incorporate things like cinnamon and anti-inflammatory. Fortunately, it's almost impossible to overdose on herbs and spices. Your taste buds will stop you before your body is affected. Cinnamon lowers cholesterol and speeds up the metabolism, helping your body to get rid of the fat that leads to type 2 diabetes. However, do not cook or heat the cinnamon, or else it loses its curative properties. And never pair cinnamon with sugar. Let's look at the long-term effects of diabetes. This applies to type 1 and type 2. Peripheral neuropathy is very common in all diabetics. Having too much glucose or sugar in the blood can lead to nerve damage. Damage to the nerves in the feet may cause you to lose feeling in those areas. Losing feeling in the feet could mean that you won't notice a sore rubbing against or an infection forming. The glucose can also feed into the infection, maybe getting worse without you even knowing it was ever there in the first place. This is why we recommend seeing a podiatrist regularly or your general practitioner. Look at your feet regularly and make sure you don't have any sores and that your feet are healthy. What can you do? Don't smoke. Smoking can reduce blood flow to the feet. Stay active. It's more common to see poor blood flow amongst those who are overweight. Stay physically active, and a healthy weight can help you maintain your diabetes and keep it in check. Eat fruits and vegetables. Stray far away from soft drinks, even diet drinks. Eat more foods from the earth. If you need to raise your blood sugar, do it through fresh fruit or dried fruits. Take your medicine. Even if you're feeling okay, make sure you keep taking your medicine. The goal is to stay in control of your diabetes. Your medicine, along with a healthy lifestyle, can help you do that. The inspiration is that just because you have a diagnosis of diabetes, it doesn't matter. You can still live a good life and live healthy. Buddha once said, "Every human being is the author of his own health or disease." And this is so true. Taking care of yourself will help you keep your diabetes in check. For more, see our health talk on nerves. This will explain how nerves work. This has been Health Talks.